Hello friends, I am Dr. Rajesh Daria. I'm an orthopedic and knee joint replacement surgeon practicing in Mumbai, mainly South Mumbai in the most distinguished hospitals the, of South Mumbai and obviously of the country. Now, to explain you, osteoarthritis is a disease which is very common, and ladies are more affected than men, and almost one third of the population is affected with osteoarthritis, and it is usually occurring at an age which is beyond 50. It could either be primary osteoarthritis, which I was telling you about, as it is wear and tear. It could be secondary to a trauma, like a fracture has happened in for some injury, and subsequently the fracture has not healed properly, and the joint line has not been reconstructed properly, and therefore there is wear and tear between the articular, means the bearing surfaces of the joint. Other thing is there could be rheumatoid arthritis, wherein it is because of the autoimmune antigen antibody complexes which eat up the synovium, and then these the pannus, which is the inflammatory tissue, which will also eat up the articular cartilage. So resultant is the wear and tear of the knee joint. This is the kneecap. I'm just trying to show you. And what happens is that the bearing surface of the knee joint is affected. Like those roads in monsoon, which have large craters, And this is a meniscus, These are the cruciate ligaments, as you can see. And this gets affected due to wear and tear, and it gives rise to pain. The important thing is that after because of the loading and because of the habits of the Indian population of sitting cross-legged, the inside of the knee, which is in medial side, it gets worn out more than the outer side or the lateral side, and therefore the knee tends to get bent inside, and that's why you will see a lot of patients who are walking with bow legs. So this is an important aspect of this disease. Although the valgus knee, or where the outer compartment of the knee joint gets worn out, is also very much in occurrence, but not as much as the inside or the medial joint of the knee. Okay. So now in these cases, what we do is initially treat them with conservative treatment when they are at an early stage, where they are still able to walk around and the pain is not as severe. Now, as the severity of the pain increases, and when the patient is no longer able to tolerate the pain and wants to have a better quality of life, that is the time when we ask them to have reserve, like the change of the surface of the knee joint. Now, depending on which surface is spoiled, if it is only half the surface which is spoiled, then we do a unicondylar replacement. If both the condyles are spoiled, then we do a total condylar replacement surgery, in which, as you can see here, what we do is we cut the joint in such a way that the slots are made, so that it can be replaced with a surface, so it will become smooth for movement. Identically, on the lower side, which is the tibia, also the bone is cut in such a way that it is perpendicular to the long axis of the tibia, and then it is replaced with a component, and there is a plastic which is like a cushion between the two bones, and that is what we call as a resurfacing or a joint replacement surgery. And the kneecap also is, if it is rubbing against the femur, that is also done. Now here, as you might be curious as to why the color of this joint is black, is because this is a oxenium knee, wherein in some cases, if the patient is allergic to the cobalt chrome or the normal alloy which we use for the prosthesis, then we can use the oxenium implant. This is slightly expensive. Now, as far as performing this surgery is concerned, there are various techniques, One is the traditional one, in which the surgeon is gifted and can perform the surgery just with his skill and his eyesight and his which most of us have been doing it for over 20 to 25 years now, and which is very well documented. The newer ways of doing it is to take help with the computer, wherein the knee is mapped on the computer, and the program helps us to make sure that the cuts are proper as desired by the program, and the end effect is the same. The newer one technology is to use a robo, wherein again it is an assisted. The robo assists us in taking the cut. So ultimately it is done by the surgeon himself, and all the other steps are also done by the surgeon. Only in taking the cuts of the bone so that it matches correctly to the prosthesis and the alignment is perfect. That is how the various new technologies help us. So friends, let me tell you that Mr. Modi ji also has helped us to reduce the cost of the implant, and the knee replacement surgery is a very, very popular surgery with an excellent success rate. And although there are other chances that there could be an infection or there could be loosening of the prosthesis later on due to cementation problems, or could be malalignment issues, most of the time, almost 98% of the times, the knee operation is a very good one, and most of the patients are very happy. So friends, if anybody of you are suffering from osteoarthritis, and if you really do wish to take an opinion, or if you do wish to go in for a surgery, then do not hesitate to contact me or my team on my mobile, which is 982 00 753, or on my email, which is rajeshpd51@hotmail.com. You are very welcome to visit my website, which is boneandjointsurgeon.com. Okay friends, thank you and good luck.